that how you are using this, variations which you learnt in the class, and what are those 3 points which is highly, emphasized during the training. Would you like to share that 3 points while teaching this prenatal yoga and bringing that variations for the pregnant women?
Yes, definitely. So when it comes to yoga, people generally feel that, okay, it's a asana. Even for regular yoga batch, people come for the asana practice. Maybe they want to sweat out a little bit, they want to stretch a little bit, be flexible or find their strength and do some maybe advanced postures also, inversions and all. Uh, so when it comes to asana, if you will not do it in a systematic manner or understanding your body type, you may get injured. So that is very much possibility. And that's where I found in this training that in prenatal yoga, especially prenatal, postnatal yoga and Garbhasanskar training, that what you have created, that 3S module, that is, I think, the key point where people can, especially the pregnant women and yoga teachers, prenatal yoga teachers, they can use that in a systematic way. It's like then we don't have to. I mean, you have not left any work for us actually, because it's so systematic, so straight. So 3S module, if you allow me, I can share what is 3S module is about.
Yes, please go ahead. So you are telling this 3S yoga module in terms of variations and remembering this, how you can teach this pregnant woman, right? Yes.
Yes, yes.
Yes.
So so basically, pregnancy is a phase of 3 trimesters: first trimester, second trimester, and third trimester. Commonly, in a general term, if I have to say, there is a lot again before and after pregnancy, but for pregnant during pregnancy period. So in first trimester, the in 3S module, it's about stability enhancement. So that a baby and a mother has to, get stabilized with the phase what she is going through. So what kind of practices she needs to do? She cannot really start with dynamic postures or, start with a lot of movement. She needs to understand her body type and the phase which is going on. The second trimester is about, so slowly and gradually she gets stable in her, phase. Then in second trimester, she starts building strength. So it's about strength development, because baby is also now settles down in her womb and gradually growing with, organs, and that's what the mother and baby start connecting with each other, and that's where she gets she can work on her strength now. And in third trimester is the time for like space creation, because it is a time for her to prepare herself for the labor and the labor pain which is happening. So how she can relax herself, how she can create more happy hormones, so that she settles her down for and prepares herself mentally and physically for the pregnancy. So
Okay.
that is 3S module is about.
Can you give example of this? First, you said that first is stability module, second trimester is strength, and third is space module, right? So,
Yeah.
one example of each of those 3S module, one asana, you can tell that, okay, first trimester, if you practice this asana, will benefit to stabilize your condition.
Okay. So in first trimester, we recommend, from the aspect of movement, it can be Sukshma Vyayam, that slow and steady manner. She can gently start moving her small joints, not a lot of movement. And mainly pranayama and relaxation, like pranayama and relaxation techniques, like meditation techniques, will help her for stability. Then in second, strength development, there are many standing postures, like balancing postures are there, like warrior poses are there. So warrior poses will help her to create more strength in her pelvic region, in her lower back region. And in third trimester, she can work more on space creation, where in aspect of Malasana and Bhadrasana, all these hip opening asanas can help her for space creation.
Okay. So now here, which asana should be avoided? During pregnancy, which asana that women can ensure that they are taking care, they are not doing it first, second, and third trimester.
So in first trimester, again, I would say she can avoid all dynamic movements. You need to do like suddenly start doing Surya Namaskara or holding the asana for a long, like especially standing, because standing asanas require a lot of strength. So she doesn't need to do in sitting. She can gently do sukshma vyayam. Mainly, she can work on resting shavasana or
So the
meditation
meditative
posture.
asana is preferable.
Yeah, meditative
And
asana.
the asana which you said, that warrior pose or the garland pose, which that woman can do later on, but not in first
Later on.
trimester, right? Okay.
Yes.
And in second trimester, which asana or posture can be avoided, and who should avoid those kind of postures?
So in second trimester, again, as the main aim is strength development. So in that case, you don't need to do a lot of, hip opening postures like maybe malasana and because those can be done in the third trimester. Second trimester is all about creating strength. So you can choose some basic asanas, but you can hold it for a long and, synchronizing with your breath. Every person will have their own capacity and potential to stay in a pose. Um, like you can do when we say inversions, like the shoulder stand with the support of the wall, with the guidance of the teacher. The teacher is available; it should be available in front of you by your side, and then with the help of the teacher, you can practice these asanas.
Do you teach inversion in second or third trimester in pregnancy yoga?
Uh, So, if that person has done these practices before, then they can attempt with the help of the wall and with teacher's guidance, with the teacher's support. So it is not that I remember, ma'am, you gave us an example at that time. It was trending. Anushka Sharma's example that she was doing Shirshasana and her teacher and Virat Kohli is helping her and in the newspaper everywhere, people were questioning that, oh, no, these celebrities, they shouldn't do inversions and it's a pregnancy mode. And I remember you saying that, every body is different. If the person who is already athletic body fitness, they are already into fitness, they have already done these practices, then with support and with guidance, they can practice. But and with the doctor's consent. If there are no complications, there is no harm. But yes, if somebody shouldn't start these practices at the time of pregnancy because that is not recommended because it's a challenging phase. You don't know what is happening internally, and at that moment, if you do something which you require more challenge, your body is giving more challenge to that, then there is a harm. So yeah, we can't say that okay you should do it or you shouldn't do it, but depend on person to person and the condition and the time.
So let me just summarize a little bit whatever we have spoken here. So it's like we have started speaking about how Deepika has started her journey in the field of yoga as a career, then how she thought of upgrading herself and learning this prenatal yoga, because there are a lot of women crowd which used to take these yoga classes majority, and there are so many gynec problem also present and women are not aware about it. And when pregnant woman comes, literally this education which has been already there, like yoga teachers training course, that it doesn't include the whole deeper understanding about all this pregnancy and the physiological changes happen. So she thought of, okay, let's learn something specially, and she found this AYG Academy through her student, and that student also knows me, and I'm so happy. A lot of crowd comes through the group, and the energy was really good. Later on, she thought, okay, let's start this conducting this yoga practically. Also, she started application of this asana. Then we spoke about the unique point of this learning prenatal yoga is that 3S yoga model. And let me share here one secret that we were actually, creating a book in which you will see even Deepika's pictures. A lot of pictures will be there. The different types of asana which is going to be there, ready-made manual for all the yoga teacher. Maybe 2023 will be the gift. We will give this gift in the form of this complete book, and guide for 3 years yoga module in pregnancy yoga. So that we have shared what exactly the glimpses, what 3 years means, and what are those asana which comes under this 3 years yoga module. Then we understood, okay, what should not be done. Okay, now here is the question: Surya Namaskar. Okay, now so
Hmm.
Surya Namaskar, do you think that, so in which trimester we can give this Surya Namaskar to the pregnant woman, and those postures which includes 12 different
Awesome.
postures, 12 different asana which actually summarize this Surya Namaskar. So
Hmm.
can we give this, and if yes, then which trimester we should give this Surya Namaskar?
Okay, yeah, as we discussed now that in from second trimester is a phase from where we start creating strength and start building strength, and now is the time that the mother needs to start such kind of movement which creates blood circulation around her pelvic region, the lower back region, and uh, need to balance the heart rate and the blood flow. So in that case, Surya Namaskar is a good practice to start from second trimester, but in again with a modified version, because as we see that the mother or expectant mother is change, her body is changing from fourth to fifth to 6 months. Progressively it is changing. So if you will do the regular previous kind of sun salutation Surya Namaskar, it might harm her
Kind of variation you
movement.
give. Suppose if Surya Namaskar somebody wants to do, so how you teach? Can you give us some kind of props or some kind of the variation which you might have taught in your class?
Yes, yes. So when generally we start with Namaskar Urdhva and when we fold forward, so especially while folding forward, she has to take care of herself. Instead of intensely folding forward, holding the ankles, pressing her chest to her thigh, instead of that, she can create more space for her abdomen and put her hands on the blocks, or slightly bend her knees and then try and reach the ground. Create more space in her legs so that she has enough space for her abdomen and the pelvic region, and then comfortably she can reach the ground. So while forward bending, she has to take care of herself, the complete forward bend. While back bending, she has to take care of herself. So the back bending can be in standing, slight back bend she can do, but when it comes to lying on the stomach, so she can avoid that lying on the stomach. So we avoid Bhujangasana in Surya Namaskara. Instead of that, you are getting into cat and cow position, and from there itself you get into Adho Mukha Virasana, like pressing her buttocks back, creating space in her knees. So those kinds of variations generally I give. So I modify the poses when
Okay.
it comes to Surya Namaskar.
So here you said that we should, just we cannot give that Bhujangasana. So here, could you tell us that top three things should not be done? While teaching asana to pregnant women, top three things to keep in mind.
Okay.
Yoga
So
teacher.
yeah, I would say extreme forward bend, extreme back bend. Then again, when it comes to inversions, you are not holding inversions for long, and intense twist. So the twisting should also be very gentle. Like if I say I'm doing Vakrasana, so in Vakrasana in sitting position, you bend your knee and put your arm over your thigh and then twist. So it's like too much pressure and too much twisting position you create for your abdomen. So instead of that, gentle twist is enough. Like even sitting in Vajrasana, if you will turn little bit, rotate your tongue and gently twist your spine, that is also twisting. That will also create a nice blood circulation and remove the stiffness around the spine. So these three things I feel most important that
Summarize
pregnant
it.
women should take care of.
Summarize it. Number one.
So number one, intense forward bend, intense back bend. Like for forward bend, she can do half forward bend, putting her hand on the wall. The
Second.
second, holding inversions for long. And the third one is intense spinal twist. The
Okay.
spinal twist position, the rotation.
Okay. Great. So from my end, I can add top three things. Number one is avoid compression or the pressure coming on your abdomen. Number two is
Okay.
holding breath. That is what the avoiding dilation of the blood vessel. Number three is while meditating, most of the time, if you can just give this, paying attention towards the uh, pelvic region or towards the womb, is going to definitely increase the blood flow towards your that womb, and it will help to nourish the baby well. So,
Hmm.
asana, pranayam, and meditation. These are the three important aspects, when we think about any, asana or any practice of
Yeah.
yoga. Even if here we are talking about asana, because asana is just the one part of the yoga. Whereas yoga contains all the Ashtanga yoga, where you have to follow do's and don'ts, and then comes asana. Then fourth is pranayam, and fifth one is the holding your all this attention going outward. And it's
Okay. Yeah.
important during pregnancy that pregnant women should bring that all attention inside the womb, and mainly paying attention towards the growing life in the womb. So
Yeah.
while meditating or any asana, if you do, that time you have to completely, trying to feel, experience that whole emotions going on in you. So those are the
Hmm.
things which I can, put into the conversation. Okay.
Wow.
What is
Yeah.
the
Thanks, ma'am.
definition? Yes, what is the definition of asana? Like Patanjali yoga, which has been very much,
Yeah.
it's kind of a book where you, if you start reading, and each sutra tells us, lots of meaning. So here, when it comes to
Yes.
asana now specifically, so it says that sthira sukham asana,
Sriram Sukhamasana. Yes.
not sthira,
So,
sthira sukham asana. Sorry to be teacher
yeah.
again here. That's where I want
No,
to,
no.
because this is very important how we chant, how we understand this sutra. So sthir means stability, sukha means feeling that
Comfortable.
comfortableness, or the feeling of that happiness within you, joy,
Yeah.
feeling
Sense
of
of
joy,
contentment. Yeah.
joy of motherhood. So when we connect with this pregnancy yoga, this asana definition, so what
Yeah.
is your inputs in this particular definition? How you can create that stability and the joy of motherhood while giving the asana?
So, I would say, like when I start, teaching prenatal yoga, teach pregnant women, I first ask her to put an intention for your practice. So, in Om chanting and deep breaths. So already she starts putting an intention that, this practice is for herself, for her own physical, mental, and psychological state, as well as the her baby's, growth, the safe and happy growth. So if mother is happy, baby is happy. So that happiness and joy already starts in the beginning by putting an intention. And when she is an asana, for I keep reminding her that okay, you have to relax your facial muscles, or your posture should be not too intense. So in that case, I felt that the younger practice which I did before, the alignment aspect, really helped me in this case, because even when somebody is doing Paschimottanasana, putting her hands in front and lifting the chest, that alignment, if somebody is squeezing the neck, then I am able to make them aware that how you need to release your relax your neck muscles and shoulders, how you can create more space there. So in that way, I give them more alignment cues, so that they can relax down at the physical level. And the breath is the most important part, I would say, to get stability. Because if you are not breathing properly, as you already mentioned, that breathing plays important role. You cannot hold your breath. That is the major point that you have to remember, or avoid doing that. So if I see that somebody is in a pose and not able to, not breathing, not paying attention to their breath, so I ask them to go back to your breath, observe your breath. So it is not about how you look or how you pose, but it is about from inside. If you are happy, joyous from inside, if you are able to become aware of your breath, then it will show in your pose. It will show in your posture. But from posture, I can figure out that okay, need to aware of she needs to aware of her breath, or she needs to be more mindful. when she's practicing. So those points I generally correct.
So, two quick question. Uh, what you would suggest that why not? I told you that why not to hold breath? Why not to
Yeah.
advise breath? But which is the practice while that woman is going for the labor? Which practice is important? Is it asana? Is it pranayam? Or is it meditation?
Uh, so yeah, I mean the highest is meditation, and to reach to that highest state, first you can check if your breath is proper. If somebody is not even able to catch that, then okay, start from asana. But yeah, meditation is the highest state which you really require when you go for that labor pain or delivery moment. So that if you are mindful, if you are content, if you are relaxed from within, and then breathing will help you. So, few tools, even you have mentioned in the training that Lamaze breathing, that is something that they can do to
Okay, this lungs breathing,
prevent.
which actually, yes, there are a lot of people, Western people have popularized this Lamaze technique.
Yeah,
Very good. The he ha the pulse breathing. Okay, in which breathing which we have in tradition, you can correlate with this
yeah,
breathing which we already have it. But when it takes the name of Western version, then actually
yeah,
we try to look into it. Okay, this is something fashionable word and fashionable technique. Let's practice it. So, which is that breathing which is already present in our yoga?
yeah. Even when I taught Lamaze before that, I made sure that they know yogic breathing. So yogic breathing or deep breaths that they should be aware of. So deep breathing, basically, or yogic breathing, it's a disciplinary way of breathing in which basically you first become aware of your abdomen, then followed by your chest and lifting the clavicles up. So when you inhale from your nose, first the abdomen is getting expanded, then the chest, and then the clavicles. And when you exhale, the clavicles are going down, chest is getting contracted, and the abdomen is moving in. So when you practice that deep breathing, that itself gives you complete relaxation at the muscular, at the physical, at the mental state. So yeah, I feel that yogic breathing is the best breathing that they can
But
do.
this yogic word, sorry to interrupt you, this yogic word is come like very much, common, means anybody can use. What is yogic breathing means actually? Means is it related to just holding breath or just lom vilom pranayam or what exactly pranayama? So I want you to tell me about which pranayama you take breathing through your mouth. Because in Lama's breathing, mainly mouth through mouth we inhale
Breathing, yeah,
and also nose. So because at the time of labor, that woman needs a lot of oxygen. That's why
yeah.
this lungs breathing
So the
has that.
cooling breath,
Yes.
you were mentioning about the cooling breath, the Shikli and Suttari pranayama. That is the main,
Calming.
that breathing which we take from the breath. We inhale from the mouth and exhale from the nose.
Yes.
So that helps. Yes.
Yes. Okay. Now, last question that do you refer other student to AYG Academy? And yes or no, whatever your answer. And then, if yes, then why? And do you get an opportunity to work with us and to spread or explore yourself professionally more? What kind of help do you receive from AYG Academy for even growing more in this prenatal yoga teaching things?
Okay. So, and I think ma'am, you have already mentioned that when I did my teacher training, already my all the students were there with me, and then we all did it together with you.
I know.
And after that, I didn't stop at all. I always mention after doing their basic teacher training course, where they can go on in which they can do specialization is the prenatal training, which without any doubt, I always mention your name. Only your name comes in my mind. So I always refer my students for prenatal training and send it to this course. Uh, because I already mentioned that this course is not just only about the pregnancy yoga, but it is overall the entire stage of a woman that she go through, and how she get benefited, where she need to take care of herself. So all that training, the complete training, you will get in this. And
Okay.
from career aspect also, I feel that for me, I mean, I've seen that not only me, but with me, along with me, the other students also, I see you have already given a lot of opportunity uh, to us to teach in your training courses. So I personally love to assist you during the training and share my views and the practices during the training, and that really helped me to grow personally, as well as it kept me close to that subject. Because even though if today I'm not if I don't have any prenatal client at this moment, with this practice, with this study, I stay connected to the subject. And then when if I get opportunity, when suddenly if somebody is coming to me, I'm well prepared. I don't feel I feel really confident to share all this knowledge and studies, and I always have your support. If I, have any doubts, I can come to you and ask you and, solve that issue. So that's how it helped me from in my career as and
Okay.
also
So
personally.
what is your last message, your message to pregnant women? Uh, what they need to do when they think of joining pregnancy yoga? Uh, what are those things which you will guide, or one message to tell them? And then we will obviously close the session. Yeah.
Okay. So, especially when somebody comes to me for regular yoga class, the pregnant woman, I actually feel that they should do the training, because with this training they will know all the complications which they are going through. If Because what happens when the complications come, that time they go to the doctor, gynec, and they try to understand the issue and try to solve the issue. But before that, if they go through, if they study by themselves and go through with this training, then they have a lot of opportunity to work on themselves. And especially when this training is not just the prenatal or pregnancy yoga training, but it has a beautiful side of Garbhasanskar. And Garbhasanskar is all about giving sanskaras on to a womb, not only as an individual, as a mother, but a couple as a together. So that sanskara, that process starts even before pregnancy, when the couple starts, the plan for the conception. And those are the phases that I feel women should understand and should start at the early age. And then later on, it will again benefit them that after pregnancy, what are the precautions they need to take care of, and when to start again come back to their routine lifestyle.
Okay. Okay. We got one
Yeah, I think you
question.
have one question.
So Prit Vipriya, 7. She is asking what is the preferable asana for normal delivery during pregnancy. I consider that you think that cesarean delivery is not normal delivery, which I want to remove your this understanding. Whatever delivery you go through, maybe vaginal or cesarean, child is obviously the delivery is normal itself. Okay, so first clear out that term. Okay. Number two, you mean to say that vaginal delivery. That is what I assume you want to say. What are those preferable asana which can help you to bring your child in the world through the natural route, that is vaginal route. Okay. So during last trimester, Deepika has already shared what you need to do during first and second and third trimester. So it's a cumulative effect which you will get it in the end as a having vaginal delivery. So, but then also, if you haven't done that asana during your first or second trimester, and if you're looking for asana during your third trimester and nearby to your date, so definitely space creating module, which we have already spoken a lot in this particular conversation. Space creating module helps you to dilate and give that flexibility to your cervix and vagina, and generate some mucus or lubricate that place so that the baby also will feel easy to come out of while rotating and coming through that thing. So like garland pose, like malasan is beneficial. Lama's breathing, that is the purse breathing pranayama practices or breathing technique, that will help you. And meditating and mantra, keep chanting that mantra, or just record that mantra in your voice and just keep playing that. So I think the this labor or the childbirth is exactly, it's a spiritual actually process. It's not just the physical process that baby is coming through your vagina, it's a spiritual. You need to connect with that the child who is coming, and you need to instruct, being a mother, being a one point of contact for that child, you need to visualize that things, and give that instruction to your baby that rotate properly, and I am with you, and please come through the this vaginal route, and create that positive emotion and bond so that the baby can connect with you, and definitely the delivery will be vaginal. There are so many patients with whom I have personally worked with, and it's definitely the miraculous thing. If you follow all those instructions, definitely delivery will be vaginal, and it's absolutely considered as a strength giving and immunity booster type of process. So we need to avoid cesarean section and boost the vaginal delivery. But both the way, whatever way child comes, and if you are healthy, your child is healthy, everything we can consider as a normal itself. Yeah. So this is my guidance. Okay. I think if there are questions, then we can definitely continue next time. And now it's a time to just conclude. Thank you so much. Thank you, Priya. I hope you got your answer. If any question, if you have, you can definitely drop in the comment box, and we will answer you through the message, or you can also DM us if any personal questions are there. We are ready to guide you. Deepika and me both are, excited to help pregnant women, to help all other yoga teacher who wants to even learn this. So be connected and stay tuned. Good night. Take care. Once again, thank you,
Thank you
Deepika,
so
for
much.
the lovely
Thank you, ma'am.
conversation.
Thank
Namaste.
you all of you for joining us.